Hello, I'm Shelley, the Serenity Doula. I'm just going to talk to you today a little bit about the pelvis and how the baby is, your baby is born through the pelvis, and why different positions in labour can help aid this or can hinder the movement of the baby through the pelvis. So think some do's and don'ts basically about what positions are good for labour and in which part of labour, because actually we need different positions at different times. So let's start with having a look at the pelvis. Here she is in all of her glory. So we have basically three main large bones making up the pelvis. These ones either side, here, the ilia. This is where the hip socket is on this side. And they join at the front here at the pubic symphysis. So we've got one of those each side. And then at the back here we have the sacrum, which leads down to the coccyx, that little bone at the bottom there. So it's a series of vertebrae that are fused there. There is some movement in that coccyx, you can see there, and there's also some movement in the sacrum. So this is called counternutation, when the sacrum tilts backwards effectively, and this is when it tilts forward, so it can come back. So you can see how that opens up space here at the base part of the pelvis when it goes that way into the nutation. And in the counternutation, if we do this, you can see that if it's like that, it then opens the space. Do you see that? That space, this space going in here opens and closes depending on which way that sacrum is facing. Now, during pregnancy, we have relaxin, which is reduced towards the end, which is produced towards the end of the pregnancy, and also during labour, when oxytocin is increasing in that wonderful cycle of building, that's also increasing the relaxin, which is helping the muscles of the pelvic floor to relax, as well as the ligaments of the pelvis. So that's holding this together. So this joint at the front allows opening and flaring here, and also opening and movement at the back with the sacroiliac joints, which are here, these large joints here, okay, which allows more movement of that pelvis. Okay, so as the baby is descending down through here, movement such as dancing and swaying, okay, so we're moving our hips, we're swaying, you see that's just moving and making that hole just different sizes, just increasing the dimensions differently, which is allowing the baby to come down through this space here. When you're upright, obviously the baby is coming out down here, so if you're upright, gravity is assisting your baby to come down. So here's a little baby. So as you can see, if we're lying on our back here with a hard surface preventing that sacrum there from moving, you can see that that's actually quite a difficult space for that baby to get out. And as the contractions of the uterus are pushing the baby downwards, forcefully down this way, you can see that they're just bashing there into the sacrum and the coccyx, which is, if you're on a bed, a hard bed, cannot move out of the way. And that's a common reason why people get back pain if they're trying to deliver their baby lying on their back. It also means that the baby has to go uphill. I don't know if you can see that in here. So if you're lying on a bed, the baby's coming through here, they've got to go up this hill here, up where this coccyx is, and if it's being pushed upwards and there's no movement for it to get out of the way, it's quite a lot of hard work really for your uterus and for the baby to get out. So really lying on your back on a bed is probably the worst position you can be in to be in labour. I know we see it on the television, on movies, that's what happens, but you are much better off being more upright. So as you're this way up, you can, and in a forward leaning position, so you're tilting forward, you see that this gives space. You see how that coccyx and sacrum can move out of the way, and you see when it's in that position how much more space there is there for the baby to come through. Now I'm just going to talk a little bit about the pelvic inlet and outlet, just so you know what that means. So the baby's got to come through this section here to begin with, which is the pelvic inlet, and then as they come out down through the vagina to exit the body, they're coming through here, which is the pelvic outlet. So it's just the bony space at the top and then the bottom of the pelvis. So you can see at the pelvic inlet, the largest diameter is here from side to side, okay, not front to back. And this is why we talk about optimal fetal positioning. So we want the baby in a position where they're coming on the left, it's called left occiput anterior, so they actually sit on this left side. So you can see then that the baby can fit through that pelvic inlet more easily. And that is because when we have our baby who's going to be all tucked up in the womb, this one's a little bit difficult to tuck up because they've got solid legs, because normally the knees are scrunched up and they're all folded up in a little cozy ball like this, all snuggled up inside, with the knees would be bent down normally, and the chin is tucked in, okay, and the chin tucks in to present a smaller part of the head from the birth canal. So actually the widest part of the baby you can see is not side to side, but actually front to back on the head. And so that's why we want them sideways as they're coming into that pelvis to fit. You see how that space just almost exactly the same shape as the baby's head? Bodies, they're very clever, you know. So yes, the baby comes through there. So initially during labour, what we want to do is make sure that this sacrum is not in the way. So you can see if it's pushing that way, it's going to make the space smaller. So we need that out of the way. See that? And we do that by being upright and slightly leaning forward, because it helps to just tilt and open that pelvic outlet. So if you see, we tilt forward, it helps to open that pelvic outlet. You see that space getting bigger. So that baby can then really push down into the pelvic floor there and help the cervix to dilate. And it just makes that dilation phase that much faster because the baby's head is pressing on the right place. If we're lying on the back, you can see, and the baby is sitting here, it's only going to be the contraction of the uterus pushing down that's making the baby go into that position, and you're trying to make them go uphill to push into that place. If they're on this side there, you see that they're having to go uphill to push onto it. So actually straight away by going upright, you're helping increase that pressure down, which helps speed up the labour, makes it more smooth and rapid. So positions to be in labour initially are upright and moving around. So as we said, doing some dancing, okay, because we're going to be swaying and just moving those hips. It's going to help jiggle the baby down into the right position. Upright doesn't necessarily have to mean standing. You can lean over a person, perhaps your companion. So you could be standing and just leaning up over their shoulders like so, swaying and dancing. You can be on all fours. I'll just show you here. Okay, leaning forward. So you can see at this position, here we go, that pelvis is like that. You can tilt. If you find the contractions too intense, you can actually tilt forward, and this just will lift the baby off. So you can see if you poke your bottom in the air, it's going to tilt that pelvis forward and just take the pressure off a little bit. So if you're finding that you need a little bit of a break, the contractions are getting too intense, that's a good position to switch to. Also, with helping babies to move down, we can use the legs. Because the legs are attaching here into this section, we've got really long levers that can help these bits of pelvis to move in this kind of direction, or we can help to flare the pelvis in and out like that. So this part's going in and out, and that can all help the baby to move down in the right position. So actually in labour, deep squatting can really help to open the pelvis up. As we squat down, what happens is it moves the pelvis in this way. Do you see how that changes the shape? See how we change the shape there of the inlet and the outlet? Okay, so a squatting position. Again, you can lean over somebody. You can do it over a birth ball. If you're feeling like your legs are tired, actually you can sit on the birth ball. And the wonderful thing about birth balls is you can get into a really deep squat. You can move and shift in this way. You can go forward and back. So turn this way so you can see going forward and back. You see that rolling and rocking of the pelvis there. And all of this supported with a ball underneath you, so you're not having to have really strong thighs. And all of that is helping the pelvis to move. So we're tilting the pelvis forward and back, forward and back. See it making everything fluid and soft for the baby to come down more easily. You can also do kind of lunges, either on a ball or just separately holding on to somebody, just one side to the other to help really shift the pelvis from side to side. Get a little bit of a movement in this kind of direction. All of these are obviously quite exaggerated. Your pelvis doesn't move quite as much as this one, so don't worry. So again, you may lunge out to the side, perhaps, or sit kneeling and lunge again out to the side. So if I tilt you slightly down there, you can see you just can stretch like this with a contraction being one side to the other, or the other side. And again, this can be with a ball in front of you, so you can lean over and just move. Bodies in general like movement, they like fluidity. And muscles and joints feel much more comfortable not being static but actually moving. Okay, so as that oxytocin is building and our relaxin is increasing, it's helping all of this pelvis to become very soft and supple, to move out of the way nice and smoothly as the baby is coming down, and everything to work in harmony. And by using gravity to assist the movement of the baby down, it really helps to ease the process of labour. As the baby's coming down, they actually twist around to get through these different holes. So as I was saying to you before, that inlet here is side to side largest, and then at the base here, you can see that actually it's front to back largest. So babies twist and move as they're going through labour. So what happens here, I'm going to try and tuck my baby up here to show you. It's a bit tricky with the solid legs. But, so they're sitting here, resting up, probably kicking you under the ribs, so you can feel that towards the end of your pregnancy, and then they're starting to ascend through the pelvis. Now you have what's called stations. Your midwife might talk to you about stations of how engaged the baby is, and that's how far they are down through the pelvis. So you start with the numbers and they count down towards 0, and then they go up again as the baby comes out. So they begin by coming down in this kind of sideways way through that pelvic inlet you see there. And then as we get down lower, the baby actually twists to face towards your back. Okay, so they're facing this way. Now their chin is tucked in all the way down here, and then as the baby starts to emerge, what they do is their head extends. So they come backwards through the hole here. So as we were saying before, remember to keep upright or in a forward leaning position, because that really helps the baby to come out. If you're lying on your back, okay, you can see that coccyx and sacrum are really pushing against that baby's head, and it means that they're often compressed against the bones here, against the pelvic rami here, which is uncomfortable for you and uncomfortable for the baby actually. So it's better to keep that pressure off as much as you can. It'll make it a lot easier. Okay, and you will instinctually feel probably like you want to get into whatever position feels right for you. Move into that position and ask your midwife, if you have a doula with you, or your birth companion to help you do so. You might just feel this doesn't feel right. I need to move here. So either into an upright position or perhaps lying on your left hand side. That can sometimes be quite comfortable. If you lie on the left, you see here that. Again, it's making a bit more space in that pelvis. You've not got that pressure of the bed pushing this part here, but you've got a bit more space. And then when you lie on the left, it's helpful because you don't compress the large vena cava, which runs up the right hand side of the body, which can make you feel a little bit peculiar. That's why lying on the left is a little bit better, gives everybody a bit more space. So yes, the baby's turning posteriorly here as the head is emerging. And once the head is out, what happens is actually the baby then, with the help of the pelvic floor, twists to face towards the inside of your right thigh. Now this is to allow that largest diameter, remember that pelvic outlet is front to back, to allow space for their shoulders to be born. Now babies' shoulders are born one at a time, and depending on which position you're in, it's often a different shoulder is born first. So as the shoulders, if you're laid down on your back, the front shoulder is born first. So this shoulder comes out first. If you are in a more gravity-assisted upright position, the rear shoulder is born first. Okay, so the shoulder twists out and is born like so, and then the other shoulder. And then usually the rest of the body just slips out very easily. And either yourself or your midwife or your partner, depending on what your wishes were, they can lift the baby up onto your abdomen or to your chest, however long the umbilical cord allows, and the baby can get skin to skin. Now, a wonderful thing that you can do is to allow your baby to do what's called a breast crawl. And this is where you lie in a laid back position, so you're nice and supported and comfortable, and you're not completely flat, but you're just semi-reclined. And if you just leave the baby, just make sure that they're safe by keeping your hands either side, they will actually, it's amazing to watch, will actually crawl up towards the breast. Now what's wonderful about doing this breast crawl, allowing it to happen, is it really allows the natural reflexes of the baby to establish. So it helps establish a really good, successful breastfeeding relationship. So they will come up towards you, and you'll see them sort of throwing themselves from side to side, searching for the breast. In that time, just after birth, their sense of smell is really far higher than it ever is at any other time. So they're smelling for the colostrum, for the milk around your nipple. And as they're crawling up here, you have a lot of oxytocin receptors in the chest here. So it just helps to really boost your oxytocin, which just really creates a wonderful bond between you and the baby. Real loving, helps promote all of those initial hormones that you need to establish that wonderful breastfeeding relationship. And so what you'll see is the baby kind of moving towards. Sometimes they'll start rooting around, so they'll start turning their head and sort of sniffing, sometimes licking, sometimes they're just feeling with their hands as well to find where the nipple is. And then they do a kind of head bob. It's almost like a snake about to strike. It's quite funny to watch. And they will just open their mouth wide and launch straight for the booby. And then latch on, and it's a really wonderful thing. And when the baby is latched onto the breast, that also increases oxytocin, and this will help the placenta to be delivered if you are opting for a physiological third stage. Yes, the oxytocin helps that uterus to contract back down to the correct size, for the placenta to be expelled, and allowing for time for the cord to stop pulsing before it is clamped and cut. And that means that the baby gets all of the blood from that system, the placenta and the umbilical cord, into them, which really is helpful for making sure they've got enough iron stores and things. So try to leave the cord until it has stopped pulsating, as this is really, really helpful for the baby. So I hope that helps explain a little bit about birth. One thing I forgot to mention actually is that as the baby is descending down, don't be disheartened if they're sort of bobbing up and down. Actually be quite pleased about it, because it's a good thing. The body designs things in ways to keep you safe and for things to go well. So as the baby is coming down into the pelvis here, you may be able to see the head and then it sort of disappear again. See the head and it disappear again. And with each contraction as this baby's pushing down, what they're doing is they're helping to stretch the pelvic floor, stretch and open. So as they're pushing down, things are stretching just a little bit and then going back up again, stretching just a little bit more, going back up again. And with these movements, if you're just breathing with the contractions, not forcibly trying to push, just to go with your body and what's happening. This is if you haven't had an epidural, because if you've had an epidural you will have to actively push because your pelvic floor muscles don't work in the way that they are naturally meant to. When you have an epidural, it anaesthetises them and you can't really feel what's happening, so you do have to actively push. But if you're having a natural labour and you've got no anaesthetic in the system, this is what happens. So as they're pushing down and stretching and then coming back a little bit towards the contraction abates, and then pushing a little bit more and then back, and then be guided by your midwife. And as the baby is crowning, so coming to the exit of the vagina, what happens is the skin really stretches round as that head is crowning, starting to crown. So really just breathe here and just allow just the contraction to miss the baby, don't force, and then the head will come out gently and reduce the likelihood of any tearing. I hope that's helpful for you. I have an online antenatal course which contains information about birth and oxytocin. It's a very comprehensive online antenatal course, including feeding and do's and don'ts and research about what the just the statistics, and also how to understand statistics that may be presented to you during your pregnancy and your labour. Just a lot of information to help you be informed, so you can make informed decisions and feel like you're making the right decision for your family, whatever that decision may be. So you can check that out on www.theserenitydoula.co.uk, and I look forward to seeing you in the next video. Take care.